What's up, everybody? It's Dr. G. I hope you guys are doing good. So today we're going to be talking about moonlighting in residency. I've had a few people ask about that, about moonlighting, the possibility of moonlighting while you're in residency, and other options of employment while you're in residency. Just because we know, guys, residency salary is basically crap, right? So, let's call it what it is. But anyway, for those that do not know what moonlighting is, so moonlighting is basically you having sort of like a secondary or part-time kind of job outside of residency, something that sort of supplements your income, or just like you have these student loans, or you need something to supplement income for you to continue to pay student loans while you're in residency, or even though a lot of us like choose to put up those student loans until you're done with residency, but at least a secondary source of income. That's why most times that's usually the reason why a lot of people find moonlighting jobs. So there are so many options available for secondary employment while you're in residency, and we're going to talk about those later. But before we get to all that stuff, guys, I do want to appreciate y'all for subscribing to the channel, for commenting, for sending me your emails, your questions. It really just kind of jogs my memory and gets me thinking of these things that are relevant to people, the questions that are out there, people that I can help. So I appreciate y'all for that. So let's delve into this whole topic of moonlighting. So about moonlighting, keep in mind, guys, not every program, not every residency program approves of moonlighting. There are certain states where moonlighting is actually not permitted, and one of those states happens to be where I am at right now. So the state of Louisiana does not allow moonlighting for IMGs. If you're a USMD, then you have no issues with that, but for IMGs and stuff, so you do want to keep that in mind. If you're interested in moonlighting while you're in residency, then you definitely want to look into that, like look into the programs and ask them for sure, say, do you guys allow moonlighting, especially if you're an IMG. Getting into this game, I knew ahead of time that my program did not allow moonlighting. I'll probably say I found out like last minute, probably a couple weeks before ranking or so, and I was actually asking them about that. They did tell me though that the state of Louisiana did not allow moonlighting, but just because there were so many positives about the program, so I didn't want the fact that they didn't allow moonlighting to be a reason why I don't rank that program high. So long story short, I would have been happier being where I'm at right now if moonlighting was allowed in my program, just because I really wanted to moonlight for sure. But the other options that I have, especially for me as a nurse practitioner and also being a nurse, is you do have the option to work at your other place where you have whatever certification that you have or whatever other healthcare training. So say you're a nurse, you're a chiropractor, you're a nurse practitioner, and you still have those licenses valid, and you wanted to work in those areas. Nobody stops you from that. The thing with moonlighting though is most of these programs, they're not allowing it just because they feel like it takes you away from your main function, your main job role, which is like you working as a resident physician. So sometimes they're not approving that. And if you do happen to go to a program that allows moonlighting, then also they do want you to have like your approval from the program director, because there has to be like set number of hours that you cannot exceed. And the other big part too is your malpractice insurance, just because when you're a resident, your malpractice insurance is covered by the facility, by the hospital where you're employed. Say you get a moonlighting opportunity and you go out to work somewhere else, say I wanted to go moonlight in urgent care and emergency medicine, any kind of emergency room or any kind of clinic out there, you do have to provide your own full service insurance. So that means you having like premiums that you have to pay every year to cover you, just in case if there were any sort of like liable event that were to happen like in the course of you caring for those patients. So that's something to keep in mind. The other thing about moonlighting too is in your first year, moonlighting, it's really, most programs will not allow you to be involved in any form of moonlighting activity at all, just because the first year of residency is pretty intense. So many of the programs will allow you to start in your second or third year. All right. So let's get down to possible employment opportunities while in residency. So like I mentioned earlier, so say you happen to be an IMG and you're in a program where moonlighting is not allowed, and you do want to find like a moonlighting opportunity or any kind of secondary form of employment, like a part-time job or whatnot, then your other option will be to first of all look and see, what did you do before medicine, right? So what kind of work were you doing before medicine? And is there like a possibility for you to secure any form of employment? And when I say employment, I mean something part-time, right? So part-time PRN basis, because your main job still remains what you do in residency, and that it's like, you make no mistake, that is your main job, and by no means you're not allowed to exceed the number of hours that you work, just because it will be inexcusable for you to, like, say, come late to work as a resident physician, or just because you will overwork your moonlighting job or your part-time job, because that becomes a big deal. And I think partly too, that's one of the reasons why some of these states that don't allow moonlighting, that's usually their main reason, just because they feel like as a resident you may go work somewhere else and then you're super exhausted and then not able to deliver or not able to perform your full job function as a physician. But just kind of keep that in mind. Going back to whatever you did before medicine or before medical school or whatnot, that can be an option. And that goes back to, say, if you were a nurse, if you were a nurse practitioner, if you had any other role that you worked in, if you wanted to find something part-time, that will most likely be the first thing that you look into. I am not working as a nurse practitioner just right now. Like I said, guys, first year residency is intense, and it doesn't make any sense to overburden yourself with that added responsibility of going through residency full-time and then also adding something else like a part-time job in your first year. But who knows, in second, third year. I have been getting calls for these like jobs and everything, but of course I have been declining them for now. The next thing you can also consider, which some people do, is like medical scribe. So you can also consider being a medical scribe. The other option too is a medical transcriptionist. And a medical transcriptionist is basically, you know how doctors, like, they dictate all of these notes and everything, say in surgery or whatnot, and to have someone transcribe these notes in different specialties. And that, in most cases, you're not looking for like crazy experience for those. Just you being in the medical field, it's usually good enough. Sometimes they even hire folks that are not in the medical field. So that's that. Medical transcriptionist, be a scribe, go back to look into like finding something, sort of position in whatever you did before medical school or while in medical school earlier on. These are the available options of things that you can look at. There are a few others out there. There are also areas that are like non-medical activities that you can be involved in. I do have a friend in residency. What he does is like helping folks with like passing USMLE exams, you know, more like a tutoring kind of thing. So some of the folks have also gone into like opening an online business, which is one that I happen to be interested in, still researching those areas. These are the possible options of seeking like moonlighting activity. But hey, if you happen to be fortunate and you are in a program where moonlighting is allowed, I know I did interview with several programs like last year where moonlighting was actually allowed, but I consider it to be the kind of curveball that life throws at you. Like the one place that you really wanted to be at, my number one place, my number one hospital where I really wanted to be at, happened to be one that doesn't allow the moonlighting that I wanted. But then again, just like everything in life, you do have to weigh your risks and benefits, right? Just kind of balance things out. And so in conclusion, guys, just to reiterate a few of the things that you can actually do for a secondary source of income while you are in residency includes, so going back to whatever job that you had before, so going to seek something part-time. But remember, you do have to wait till you're in second or third year in residency in order to do that, just because we know first year residency is cray. Okay, so remember that part. And the other thing you can also do is to say you're in a program that allows moonlighting, you basically just directly reach out to these hospitals. So urgent cares and clinics are usually ones that are very receptive of like having residents like work in those settings. So that's actually a common one. So I mentioned before, it's tutoring. You can consider tutoring. So USMLE courses, medical school courses, whatever you're really good at, there's always someone that needs that assistance. There is actually an interesting one. I've actually looked into this myself. It's creating online courses, just because. So there is this website called Udemy, Udemy. I actually personally used it in the past, and it's more like individuals. It's more like you're a freelance course creator. So you create courses, something that you're very familiar with, something you feel like you're good at, and you can actually educate others on that. And sometimes you create these courses and each person buys a course every time they download a course, and they're usually not that long, and it didn't take that long to create, because I've looked into it, like I said, and you have like different prices and stuff like that for them. So that's something that you can consider doing. The other one too is, say if you love to write, you love to read, so you can also be a freelance like medical writer or medical editor for a lot of the medical related articles and things like that. So that's something to consider as well. I remember mentioning the medical transcriptionist earlier when I started video, and another one to consider medical scribes, so you can do that also. So that's also something else to do. But anyway, guys, I will go ahead and end it here. These are the possible options. But remember, most importantly, if you're looking to moonlight at any residency program that you're getting into, it's really important. It behooves you to really check it out, like check on their website, and be sure to ask them, say if they call you for interviews or anything, ask them like from the get-go, do you guys permit like moonlighting? Is that something that's approved in this program? And if you're an IMG specifically, ask them that, just so you are not burned by the time you get into it and you're disappointed. Like I said, it wasn't a big shock for me, and it's not the end of the world, but at the same time, I would have been actually happier if I had the opportunity to moonlight. But anyway, I'll go ahead and stop right here, guys. I appreciate you guys. Okay, again, I do want you to please go ahead and subscribe. Don't forget to comment. Don't forget to like the videos. Don't forget to hit that notification bell. Just do everything you got to do, guys. Again, I appreciate y'all for doing all of that fancy stuff. Until next time, I will keep in touch. All right, then. Thank you.